Well, welcome everyone. It is our Spokane County Regional Interlocal Leadership Structure meeting. I'm going to say that, sorry, it's always the mouthful there. It is March 8th, 2024. It is 2:30, so we're going to go ahead and get our meeting started. What we may do is just kind of, we'll go around the conference room here so everyone knows who's here. And then we'll kind of see how we can, I don't know if you want to try to figure out how to do it online.
Yeah.
Okay. So I'm Spokane County Commissioner Mary Cuney, Chair of the Board, and welcoming you today.
Hi, Dorothy Savanish from Molina Healthcare here in Washington. Ashley McGee, Integrated Behavioral Healthcare Manager for the Spokane County Regional Behavioral Health Administrative Services Organization.
Good afternoon, everyone. Justin Johnson, the Director of Spokane County Community Services Department.
Nancy Locke, Office Manager with Community Services Department.
And we'll go down the list for individuals we have currently here. For those that are not speaking, please keep your mics on mute so that we can go through that. And I will go down the list as we have. So when you hear your name, please give your name, organization. We'll go down the list. Michael Langer, HCA.
Good afternoon. Michael Langer, Acting Director, Division of Behavioral Health and Recovery within the Healthcare Authority. Good to be with you this afternoon.
Welcome. Connie? CHPW?
I'm so sorry, Joe. This is Connie Mumchings, Senior Director for Regional System Integration with CHPW.
Welcome. David Nielsen.
David Nielsen, Executive Director, Northeast Washington Alliance Counseling Services for Ferry, Lincoln, and Stevens counties.
Kelly Miller.
Hi, Kelly Miller, Interim CEO, Frontier Behavioral Health. I'm going to shut my blinds so you can actually see me.
Hey, Kelly. Kimberly Wright, HCA.
Hi, good afternoon. Kimberly Wright, Behavioral Health Operations and Planning Supervisor at Healthcare Authority's Division of Behavioral Health and Recovery.
Megan LaPalme.
Hey, good afternoon. Megan LaPalme from Department of Commerce. I'm the Community Programs Manager.
Greetings. Liz with CHPW.
Good afternoon. I'm Liz Perez, Senior Regional Manager for Regional Systems Integration for CHPW.
Greetings. Commissioner Rosenkrantz.
Robert Rosenkrantz, Ponderay County Commissioner, District 2.
Greetings. Welcome. Teresa with HCA.
Good afternoon, Teresa Claycamp. I'm the Behavioral Strategic Advisor for DBHR here at Healthcare Authority.
Excellent, thank you. Tori with Molina.
Hi, Tori Gildred, Associate Vice President of Behavioral Health for Molina Healthcare.
Excellent. And Vicki, Adams County.
Hi, Vicki Goosey with Adams County Integrated Healthcare Services. I'm the director here.
Welcome, Vicki. Anyone else I may have missed? Because I cannot see on my list. If none, then we'll proceed forward with our meeting.
Okay, and Justin, I'm going to let you take over.
Excellent. Welcome, everyone. It's good to see everyone. Welcome to our later afternoon meeting for the SCRILS. Just as a reminder, as we go through some of the perfunctory pre-meeting discussions, if you have your mic on, please keep it muted while we're discussing. If you want to provide a question and or raise your hand, please so use the functions. I think we've all become very familiar with those. And for the topics that in the agenda, specific items that are addressed, we'll be addressing those as they come up. So we'll be calling out those specific entities. If you did not have someone listed, we'll be calling on those representatives to identify themselves in advance and just identify who will be speaking on those. And then also, we'll try to have public comments and community stakeholder feedback towards the end of the meeting. Remember, we'll go through the specific topics and then call out the specific community stakeholder agenda topics and updates. Is there any questions, feedback, or input before we get started on our first update? All right, and as a reminder, this is the last meeting in our cycle that will begin at 2:30. Starting our next cycle, we'll start at 10:30 a.m. We'll keep to our cycle on the Fridays, but we'll move to a 10:30 a.m. meeting schedule to meet with the feedback that we received from those here on the call. So just want to remind that, I'll remind at the end as well, but I wanted to give that as a call out. This is the last meeting at the 2:30 period. All right. There's no input and no messages. We'll turn it over to Department of Commerce. Megan, it is all yours.
Yay, thank you. Let me get my screen shared here. Oh, it won't let me. You might have to stop sharing yours. Thanks. Okay. All right, does that work for y'all? Can you see that?
Yes, we can.
Awesome. Thank you so much. Well, I'm Megan LaPalme, again, here from Department of Commerce, just giving an update about behavioral health facilities coming your way or maybe in the pipeline. I'll work through these slides and know that Leslie wasn't able to join me today. So she's the person that like really knows everything. So I'll be doing my best and I'll be able to pass any questions on to her too if anything comes up that I can't answer. So here we go. So Commerce strengthens communities, and we really see our role as the behavioral health facilities group, strengthening communities by bringing care options close to home and close to communities for folks. So, we obviously have lots of other things. I'm sure many of you are engaged in our other programs too. So here are just a couple of basics about our program. And I know lots of folks were here last year about the same time when we gave this overview, but I know probably there's been some changes. So I'll be quick. If you have questions, feel free to let me know. But behavioral health facilities, here's our overview. We grant funding to community hospitals, community providers of mental or behavioral health services, including local governments, tribal organizations and governments, nonprofit organizations, and for-profit businesses. All of our grants must increase capacity for behavioral health services. So it depends on the type of facility. Sometimes that's new beds, sometimes it's new recliners, and sometimes those are new outpatient facilities. We plan to have grant rounds running for the autumn and spring each year, as long as we have funding. So if we get funding, we just got a little bit in this most recent capital budget that came out that we'll have for next year, or we'll be able to fund down our list if we have folks that aren't able to get funded with last year's allocation. We'll be able to fund them with the new funds. All of our grants reimburse capital costs. So we're not paying any of those operating costs or, no Medicaid reimbursement, that kind of stuff from Commerce, just construction, capitalized equipment, and acquisition of buildings and land. Any of those things that we might fund through our grants must result in increased capacity. And our projects or our grants require a 10 to 15 year commitment, depending on the year that the funds were awarded. Sometimes that changes based on the proviso. And we monitor that commitment period through deeds of trust. We have an in-house monitoring setup with real estate and with our amazing agency partners. And that's also being bolstered right now too, through some new work with a new proviso from last biennium. And speaking of our amazing partners, here's a list of a lot of the folks that we work with, though certainly not all of them, but you can see that we work with Healthcare Authority, DOH, DSHS, our MCOs, BHASOs, and building more of our connections with accountable care organizations, associations of county human services, and accountable communities of health. All right, so the big exciting stuff is for our 23-25 funding. What we saw from the biennial budget, and notice that since the capital budget for the interim is not signed yet, we haven't added those funds here, but there are some further enhancements to these buckets. with that funding. So we did receive $28 million for regional needs, $24 million for intensive behavioral health treatment facilities, 18 million for children and minor youth. Those three are competitive funding rounds, and they've just closed, and all of those applications are under review right now. And then the closure prevention is kind of a new fun one that we got this last year that is $7.5 million, and it's for facilities that are at risk of closing because of a capital issue. We've seen some where there's a fire system, fire suppression system was going, because it was out of date and not in compliance, the facility was going to lose their license. Those are the kinds of applications that we're seeing right now for those funds, but it's on a rolling basis. We're reviewing those applications all the time, and that is open now on our website. So if you'll know of anyone who is operating a facility that's having a capital issue that will lead to their closure, please, I'll drop our website in the chat, but please send them our way to apply for those funds. There's no cap also for the requests. So like I said, the rounds are currently closed except for that closure prevention one. We received 39 regional needs applications. 12 of those are on the east side. 14 IBHTF applications. 3 of those are on the east side of the state. 13 children and minor youth applications, and 2 of those are on the east side. So we're not being super specific about where those are located, but because they're still under review, we're trying to keep it pretty vague. And sorry about that, but know that we do have considerable representation for the east side, but I'm not sure about how equitable that is based on population, because we know there are so many folks living on the west side. And so we would hope to have equitable representation. So far for closure prevention, we've seen 7 applications, and 2 of those are on the east side. So fewer than a third are east of the Cascades. All right, and just a quick kind of overview of how projects are selected and how projects are located. A big part of selecting projects is really based on the legislative requirements in the proviso allocations. So sometimes there are regions that are specified, sometimes there are specific facility types and numbers of facilities. So you saw in that last slide, like there's the regional needs bucket. That's really open to, well, whatever is needed in the region, but sometimes too, like the next one down is the IBHTF bucket, and that's a specific facility type. So it varies what they give us in the budget each year. And then we have to understand what the regional need is for a specific application or facility type that someone is proposing. So we get the applicant perspective, and then we also get to, from our agency partners, hear their perspective on what the regional need is. We also evaluate project readiness, if they have a site identified, if they have all of their funding committed, and of course, if there's funding available to be able to allocate to a project. And factors in locating projects. So locations are 100% determined by applicants. They may construct a new facility, renovate an existing facility, expand an existing facility, or acquire a property. We do really encourage that connection with local governments through the permitting and zoning and essential public facilities siting, and the letter of certification for zoning. We are asking folks to get in touch even earlier than ever to make sure before they apply that the site they want to use is an eligible site. I'm not sure if that's the right, or it's zonable to be able to offer that kind of service at the site that they're hoping for. We also hope to see lots of partnerships between providers and local governments to really bring these to life and offer the services that folks need. We also require that our prospective grantees or our applicants have BHASO support, a letter of support from the BHASO and their MCOs, whoever they're in touch with. That is a requirement. we appreciate it too. We've been reviewing lots of them and appreciate all of the work that went into creating those. So projects funded in the region, we have just one that came in the biennial budget for the Spokane Treatment and Recovery, is it Services, STARS? They received a direct appropriation in the last budget. And we haven't, since the budget's not signed yet, we haven't added in all of any new ones that will be coming up. But we did get a significant number in the budget that's up to be signed, the capital budget, more direct appropriations coming.
Megan, I have a quick question on that.
Please,
With
yes.
the STARS facility, is that just for improvement of their existing, with the acquisition of the Cali facility, or is it for a specific set of services at that location?
So it's only capital funding, so it's for the facility, but I'm not sure. I know that they've been trying to figure out the specific direction they're going with their project, so I don't know exactly which site that one is for. I can follow up though and get more info for you.
That'd be great. I saw that in the appropriations that the budgets are putting through with the Senate and the House. So we've been tracking this for some time in the leg session, and I've been working with STARS, but it would be great to know because we're looking at potential engagement with them as they look to provide services. We want to partner, but we need to know if that's going to be a partnership that will continue that service or a specific set of services within Spokane County. And they were really great on taking on that Cali location, which was Daybreak's original location that they ended up turning over. And I know it's for adults for, again, a very set of services, but if it is specific at this investment, that's the kind of information we'd like to know so we can prepare in advance and how we would partner with them on that.
Yeah, one thing that I do know is that this was to basically make the project whole for one that they had been awarded in a competitive project or a competitive award. Is it the biennium prior? So it should be something that we know, but I know they've been working out how they want to use the funds. So I'll get back to you because I think that I'm pretty sure that it is for that old Daybreak location, but I'm just not 100%.
Appreciate that, Megan. Thank you.
Yeah, for sure. These are just some of our previous investments that were made in the region. So these were the 21-23 investments. And I can...
Megan, a quick question on that.
Yeah.
And then I had been tracking this because you guys have it posted on your website. You have the estimated completion date, and I see a couple there. It was supposed to be completed both in 2022 and 2023, but we haven't heard about some of those going online. Do you have any updates on those facilities like the Green Acres or Relief going online?
I don't know. I know that the staff, our project or our contract management staff are working them, but I haven't heard about when they'll be completed. I can pull, I'm just making myself a list. I'll just send a message out to folks to get some updated things, and I'll give them this table and they can update it directly in there and I can send that to you. No problem.
I appreciate that, Megan. We hadn't heard from them directly after they had reached out to us 2 years ago. And it'd be helpful to know if they're actually operating, doing that service, especially the ESFs. I know that we work quite closely with them, and especially with Eastern State Hospital for transition of individuals. So since we're not as directly involved with that, and I think our Medicaid partners are the ones that are probably more involved with their members being transitioned, it'd be good to know about how those facilities are taking individuals in our region at least.
Sure. Yeah, we can at least get you, if we have a new estimated construction completion date. And I know DSHS has been working really closely with the ESFs on when they're coming online and things. We've been working with them too on some monitoring stuff. So hopefully there's more info out there. I'll do my best to bring all that together as much as I can.
Excellent. Appreciate that, Megan.
Sure. Let's see. And then these are more like further back historical investments since 2015. And this is something that we've shared here before too. But same thing, there are probably some older completion dates here. And this is part of our monitoring work that we're trying to really hone and get up and running to better understand this and have this list be more up to date. Because we know things have happened certainly over the last 4 years with just material availability and schedules and labor costs and all of that. So we know that many, if not most, of these folks have experienced some delays. Some not, some are up and running and going. So. All right, so here's a little QR code. If you want to stay up to date with our team, you can use our little QR code to go to our website and sign up for email updates. You'll see this item down in the bottom right corner. You'll see that on the website, and you can just type in your email address there and be updated regularly. And that's how you find out if we have any new grant opportunities coming up, and you know, anytime we announce awards, things like that.
Excellent.
Great. And of course, if you know folks who need help, we do offer technical assistance, of course, for folks that we're working with already, but a lot of folks will have questions about grant opportunities and things, and y'all are welcome to reach out to us, and same with in like future applicants or folks that have an application in the pipeline. Always reach out to us. This is the best way to get a hold of us at bhfinquiry@commerce.law.gov.
Very good.
That's all that I have. I'm open for questions if y'all have any, and certainly you can always email us or call us if you have something else. Check the chat too. I wasn't sure if there were any questions that came up there.
Yeah, Megan, we do have a question from one of our commissioners in Stevens County, specifically discussing some of the challenges associated with the Chihuahua facility and requesting that there would be some consideration and recognition of the challenges associated with putting a facility without regional or community involvement in the decision-making process, and how that can be incorporated within the current consideration of funding, allocation, and award to prevent that from occurring again. I believe that's what the question is attempting to achieve. Do you have any feedback on that?
Yeah, and that's part of what I was hoping the highlights about the program would help illustrate. Is just that we've done a lot of work with getting those letters of support and having folks have that set up before they even apply for funding, so we can understand better where they are with working with their local government, any kind of local infrastructure that's there or not there, and also with their BHASO and MCOs. That it helps us understand more of the enabling environment around that facility or a potential facility, and kind of understand what they're working with. So we're making lots of changes to try to address things like that. So appreciate that.
Thank you, Megan.
Yeah.
Any other questions from those in attendance or via chat or raise hand function? I know, Megan, from the Spokane Regional BHASO, because you did speak on us providing letters of support are required for those facilities requesting those behavioral health awards or grant considerations with Department of Commerce. We have been writing letters that would indicate our desire to want to support individuals in a collaborative or communicative engagement, but we've stopped short of actually supporting any facility, recognizing any facility's consideration, efficacy, or ability to provide that service, and or their long-term sustainability or financial feasibility, because there is no ability for us to be able to make that consideration without either further review, a complete and utter community assessment, or feedback from our commissioners on whether or not that's a facility they support. So I want to just throw that out there. The Spokane Regional BHASO will work with any partner who comes online that the state has designated. But short of that, and the commissioners directing us to support a facility directly, we don't and cannot provide such a review within a community that provides a systematic look at what is feasible, because none of these have actually provided any sort of community assessments or needs review to support those. So I guess from that perspective, how does Commerce provide feedback when they come forward and they submit that? And it sounds like they may also be getting letters from our managed care organizations. How do you guys review that when there doesn't have an accompanying review of the needs assessment from the communities themselves?
Yeah, I mean, I want to acknowledge what you're saying, that it's really complicated. There's a lot that goes into citing a facility, to supporting a new facility coming online. And I've noticed this is I don't think it's the first time we've required letters of support, but definitely we've been very clear that the letters, we must have a letter from a BHASO and an MCO. But we're reading between the lines on what it means to hear in a letter of like, we support this facility versus, like you said, we agree to maintain communications with this operator or this potential facility. We hear that, and we know that it needs refinement in the process and some help and support for our folks being asked to write the letter. So certainly that's somewhere we plan to rise to that occasion and be more supportive with. But we know that you all are the folks that know your communities the best. And that's your perspective on that is really helpful for us. So I think it sounds like we need more understanding of what the needs are in the communities, as well as the expectations or needs that the commissioners are seeing. So I think I'm hearing that there's just more that we need to understand. Is that right?
Well, from our perspective, I appreciate that you have a welcoming understanding of what we're trying to convey via our letters. I think that was the important part. It's not just, hey, you got a letter, check a box. It's what does the letter contain versus what is the specific needs. And I think for all of our respective counties and municipalities that are here and represented today, that is something that they've expressed vehemently as our needs in our region should come from the voice from that region and not just from a secondary source that may or may not be operating within there. I've tried to convey that, which is why we've been very strategic in the letters we've written to ensure that before we write anything saying we fully support either a commissioner or the representative bodies within those regions are acknowledged. So in that, I just want to convey, this is to you as well as to all of those representatives that are on there. No letter has been written that we would not have already reached out to those representative bodies within those regions to receive that support. And that's what we put forward in our letters to Department of Commerce.
Sure. Thank you. Yeah, I appreciate the partnership on it. And I also appreciate just I guess maybe I want to communicate too, like our need to understand the needs in the communities. And so it really, the letters are helpful for us for that. And if there are other ways for needs assessments and things like that to be able to document what folks are seeing in their regions, in their counties, in their towns, any level of local government that helps us be strategic too about what we can put forward and say that, a grantee may tell us in their application, there's a need for X, Y, Z. Well, we want to make sure that that's legitimate need and not just a business opportunity, right? Those are different things. And so we want to make sure that that's something that we're recognizing too.
Excellent. Thank you, Megan. David, get your hand raised.
Yeah, so thanks, Justin. I just wanted to say, for the Stevens County perspective, as you know, we were the recipient through Providence of 2 separate grants to develop the ENT inside Mount Carmel Hospital, then watched the intensive behavioral health treatment facility in Chewelah, and then we put in a regional application in the current round. So having put in essentially 3 applications myself over the course of about 10 years, the current application, I think, was the most complex, labor-intensive application that we've ever had to submit for actually something that's less complicated than we did when we first started the ENT. So just in response, I think to Commissioner McCart's comment, I know there were concerns about how things went with the IDHT and Chewelah, but from my perspective, Commerce has really changed and demanded a great more deal of information to really substantiate that a provider is ready and capable and has supports for facilities than anything that I have ever participated in the past. So I think this was a very complex process and really needed to, I think, do much more to demonstrate need than I've ever seen before. So I just wanted to say that.
Thank you. I'll share that with the team too. They worked really hard to make that application get us the information that we need. So helpful.
David, thank you. And I would concur with that, Megan, with the questions we received. Department of Commerce has been much more diligent in that regard. And specifically to the regions that had facilities that we are working with that got that approval, the ASO has been much more strategic in how we approve those as well, seeking out guidance from those elected officials in the region specific to be affected by those grant awardees, as well as our own governing board on determining how and which ones we would approve. So I know historically it's been like, oh, we need the facilities, make sure everything goes forward. And I think now we're more recognizing what specifically needs to be done and what could be incorporated with the existing services to ensure the ongoing treatment and intervention modalities without actually affecting the existing services and providers already in place. So there's no detriment effect. That's what we're trying to achieve. And I appreciate Commerce's feedback and engagement on that.
Oh, and thank you so much for using your networks to engage folks in making those decisions to support. And that's what we need. That's precisely what we need. So thanks.
All right, any other questions? Any other feedback, thoughts, feelings? Expressions of joy, elation, and/or.
It's Friday. I hope there's some joy and elation in the room.
I know. I always try to give that at 3 o'clock on a Friday after a long week. If anyone was just go, woo, that'd be great. But I don't see that. So I'm going to say my sincere gratitude to Megan, you and your team for all the work you do. And thank you for joining us today to share to our region. If there's any other questions, of course, we can push those out to the subsequent municipalities. So please let us know. But Megan, thank you for your time. And I'm so grateful that we could actually guarantee you a time and then stick with that. So I told you I would ensure that. So my appreciation and again, sincere apologies for the last time.
No, don't. We totally forgot about it. So
well, I never did. So I hope you know that.
I'll drop our website in the chat as well as our general inbox email address in case anybody has anything too. Thank you.
Thank you, Megan. All right, moving along. We'll go to our Department of Healthcare Authority representatives. Do we have anyone there? Michael, I saw you on there. Are you or your team?
Yep. I am on here, and Kim Wright is on here. And Justin, I think Kim is going to walk you through a little synopsis of the bills that passed related to behavioral health, as well as some of the investments that were made in the budget. So if that's what you were asking for, that's what we're about to share with you a little bit. So there's a lot, and so we'll try to do the speed round. And I think, Kim, are you ready for that?
I'm ready for that. There is a lot. So if I go too fast, just holler at me, I guess. Yeah, and happy first day of interim. That's what I'll start with. I'm not sharing my screen yet, so I'm gonna see if I can go ahead and share screen so you can follow along with me on our slides. And then also just make sure that I think you should be seeing my screen now. I cannot see the chat, so please let me know if somebody is hollering at me to go slower in chat. So Healthcare Authority this year looked at over 350 bills, and just in Division of Behavioral Health and Recovery, we worked on 176 different bills this session. Quite a few hearings, a lot of tracking, some presentations, and just a continued focus on behavioral health that we're so grateful to see. I'm going to start with my favorite bill, Engrossed House Bill 2088. This is our agency request legislation from the Healthcare Authority, and we used this agency request legislation to fix the statute surrounding liability protections for responders who are dispatched for mobile rapid response and crisis teams in that community-based crisis team response. And so we're really excited that this passed. We thought that this was just a gap in that legality and that statute from last session. And so we're glad to see these protections extended to those crisis team responders. And then 2247, it addressed the behavioral health provider shortage. So this includes higher education certifications, grants for rural training programs. I'm not going to get super deep into each bill, but so I guess I'm going to just do high level. I think I'm going to go too deep if I start telling you all the things the bill does. And then 5920 lists the certificate of need of requirements for psychiatric hospitals and beds. With 1929, this is the post-inpatient housing. So it supports 2 transitional housing behavioral health support facilities, one on the east side and one on the west side, to provide support for young persons exiting behavioral health inpatient treatment for about 90 days. And each of those facilities will have about 6 to 10 beds. 2256, this continues the support for the Children Youth Behavioral Health Work Group and their strategic plan and advisory work. And then 5853 extends the crisis relief center model, that 23-hour crisis relief center model that passed last session. And it extends it to providing behavioral health crisis services for minors, or the ability to provide behavioral health crisis services for minors. 6109, this is supporting children and families. This includes child abuse and neglect, kind of resulting from that high potency synthetic opioid, or a non-exhaustive list of kind of what may establish the basis for harm. And that directs the provisions of services for children who are impacted by living in an environment with those high potency. And then 5580 is improving mental health outcomes, and it increases the federal poverty level requirements and a number of post-delivery and transitional care things for maternal health outcomes. I said I wasn't going to get deep into each bill, and then I keep describing them because I feel like skirting high level this might take me a while. 1877 is the coordination and recognition of the behavioral health system with tribes and our Indian health partners, and specifically the Involuntary Treatment Act, and providing tribes notice and support with our dedicated crisis responders in the ITA. 6228 is concerning treatment of substance use disorders. And this requires our health plans to authorize at least 14 days of inpatient and residential substance use treatment on the first utilization review, and then at least 7 on subsequent. It also caps certification fees for substance use disorder professionals and trainees at $100. And then 6251 is coordinating our regional behavioral health crisis response and suicide prevention lines. So this is ensuring that coordination between 988 and those regional lines that have existed. 1956 is addressing fentanyl and other substance use prevention and education. There are a couple education and campaigns around fentanyl and opioids. And 2112 is another prevention and education. This one is geared at institutions of higher education. 5906 is a prevention and education drug overdose campaign. 2396 is concerning fentanyl and other synthetic opioids. and has a public outreach campaign and other education efforts. And then 1699 creates the Tribal Opioid Prevention and Treatment Account and gives 20% of the distributor settlement to insured into an account forward. And then we have quite a stack of new budget items that we're really grateful for. Some of them are going to tie back to bills that I've just talked about. We see the support for post-inpatient housing for young adults, and I just talked about that in a House bill previously. We see support for our wraparound services for civil commitments and that work for our DCRs, and support for a new opioid recovery center in Seattle, support for the long-acting injectable buprenorphine. We see new budget support for our ASAM training. There's a couple new youth behavioral health applications for mental health and behavioral health supports for youth and young adults in an application-based format. One is going to include a work group. Our CCBHC expansion grants, and then Olympic Behavioral Health Hospital, which has some support for Healthcare Authority to look at about 40 beds at Olympic Behavioral Health, and then also partner on a survey and kind of long-term what that will look like.
Hey, Kim?
Yeah.
Give you a chance to take a breath for a moment. On the CCBHCs, that's really money for sort of bridge funding from those that had the federal grants and are waiting for the direction from the state on how we're going to invest in the future with CCBHC. So it really is a continuation more than an expansion, if that makes sense. So just want to clarify that real quick. And proceed, Kim. Feel free.
Thanks. There's 17 slides here, so if I seem like I'm trying to rush through it, don't know if I don't rush if I'll get there. For other new budget items that we got, which shouldn't stop you from asking questions if you have them as I'm going through. We saw support for City of Maple Valley to have a community resource coordinator, the 23-hour crisis relief center grants, some support for that. I think that number on the screen might have a couple of extra zeros though. Crisis stabilization support for Island County. That adolescent and young adult behavioral health tech is another one of those applications. There are two separate application supports there in the budget for the youth and young adults. And then additional support for our health engagement hub pilots. I think that this is 3 additional health engagement hubs. Michael, is that?
Yeah, it's 3 additional hubs. They're $1 million each, so 3 additional.
We're really grateful for that support. Then there's some support for community-based teams who are serving people with opioid use disorder. Support for UWAI and HCA to contract with UWAI to work on high THC cannabis and education and support around that for individuals who are affected by serious outcomes from high THC. And then funding for House Bill 1877 that I mentioned previously, and that's support for behavioral health for tribes. Support for King County and their costs for their commitment hearings. Support for North Kitsap and a recovery resource cafe there. Support for a treatment provider in King County who experienced severe flooding. And then really excited to see support for the harm reduction vending machines. This was in all budgets and a lot of discussion on this one, but we're excited to have more harm reduction vending machines accessible across the state. A rapid methadone induction pilot, some street medicine teams and pilots and support. There's continued funding for the Behavioral Health Comparison Rate Project, which is really important work. And ensuring occupational therapy is accessible for behavioral health clients and BHAs who would like to support occupational therapy for those clients. Our 1915I waiver was fully funded. There is a budget proviso for innovative care in behavioral health education. The behavioral health crisis coordination, 6228, the substance use treatment bill mentioned previously, was funded here. The mental health advanced directive bill, which I believe is actually 5588 and has the wrong number on this slide. Sorry, that one is below. Mental health advanced directives is not 6228, and I'll get the number and update that slide. And that work group to explore mental health advanced directives for the Healthcare Authority. And then Healthcare Authority's Community Prevention and Wellness Initiative was supported. And that's something that is already out in the community, and that support was continued support. We had an expansion of our Oxford houses, a tribal fentanyl summit, supports for the Icelandic model for tribal prevention in our tribal community, and just additional tribal opioid prevention supports. And then I have just raced through policy bills and budget items. So do you have something you'd like me to go back to and talk about more, or are there any questions?
Thank you, Kim. I don't see any questions in the chat. I'm looking for raised hands. Not seeing any. I guess the only question I have is specific to the Spokane County Regional Service Area. Is there any specific allotments of funding in the budget that was passed or is expected to pass with the governor's signature that we should see allocated to our region of note? And I know I say that in a general sense because there's probably quite a bit, but anything of specific note that HCA was tracking and or wants to call out?
There is, oh, go ahead, Kim. I was going to talk about the one on, there's 158 provisos. Let's go there first for the biennium for behavioral health.
Yes.
So that's a lot, right? But if you're able to find proviso 112, that's the one that talks about the daybreak facilities. And there is some direction there about Southwest and what to do with that facility down there, as well as there's $1 million there for Spokane. And it gives some descriptive of who that goes to. So just, that would be one I would call out. And then Kim, I was gonna say that we'd have to dig in here a little bit more, but the street outreach on the Senate side had Spokane listed. I don't know if that language came when they combined. We have to go look at that, whether they called out Spokane or just alluded to it. But those are a couple I think of.
Yeah, I think that the street outreach does have support for Spokane and for counties on the west side. So I'll confirm that and then maybe send those notes out to this group. I think the post-inpatient housing calls out one facility on the east side and one on the west side. So that might be one to watch for, that post-inpatient transitional support for youth and young adults is one that I keep an eye on for Spokane County. I feel like there was another one that I was just going to mention to you all and it slipped. But you know, I'm also happy to, like, we've been digesting this for just about 2 days. So also happy to come back and talk to you more as we learn more about these provisos and how we'll implement.
No, I appreciate that, Kim. I've been diving in that as well and tracking. So as I know a lot of our partners who've been pretty involved in the legislative session. So just want to make sure that we were able to call out anything specifically that HCA would like us to know. I know there's a lot that gets delegated to HCA to put out. So it's always good to touch base, and we'll probably hear more about this in the coming months and or year. If there are any questions from any of the other partners on the Zoom call and or through our chat. Seeing none and giving the obligatory 3 seconds for the reply. Kim, you went through quite a bit of information in a short amount of time. Excellent work. Appreciate that so much. I don't know if anyone else could do it just so eloquently. So thank you so much.
Thanks so much for having me. It's always a pleasure to come and speak, but I'll be happy to see you next time.
Excellent. Of course, you too, Michael, as well, as always. Appreciate you sharing as well.
Oh, thank you all. Have a great weekend.
All right. Any other last questions or feedback for HCA before we let them go and move forward? Going once, going twice. Sold. Thank you so much, Michael. We'll see you. Have a wonderful weekend. All right, we'll turn it over to our regional updates. We did give time for the ASO to give updates specific to our region, but of course, we'll always allow for the opportunity for our regional providers as well and our regional authorities for all of our counties to give updates if they so choose. So we'll start with ASO and then move to our counties and then to our providers. So we'll start there. I'll give a regional update on our OAC. For the municipalities that are on the call here, or what the One Washington MOU calls our participating local governments, we've been hard at work providing feedback and providing a dashboard for the region as required by the One Washington MOU. This has been something we started back in 2023, July, and then we've continued that work. Again, this is specific to the work that is regionally done for the OAC, which is administrative. We've discussed this. It is not specific to the work being done by each of the municipalities that are involved in the OAC. So I'll defer those to those groups who want to share. I'll just be sharing on what the regional OAC is doing in Spokane County. So the regional OAC has provided multiple meeting opportunities for all of the representatives to share on what funding they've received and what they are doing with the funding. Currently, we have received some feedback, which is available on our webpage, on what those municipalities are doing specific for 2023 and the funding into 2024. But there hasn't been many identified areas of intervention that are of note. I know that some of the counties in our northern regions there, Stevens and Ponderay, are still working through options, especially their tri-county health. And then our Lincoln County representatives are also working through their representatives. They have identified some areas of priority, but yet have not designated a specific input on where that funding is being put forward to. So I'll defer to those if they're on the call here to share at the end of this update. But for the OAC, updates are provided via the website. We've been reporting all of the funding as required by the One Washington MOU, and all of the meetings have been very productive in identifying those key areas. That, I must say, it's been very appreciative. I know that it's taken a lot to get to that point. So for all the municipalities that have shared information, especially the funding portions, I know that's always a little more challenging to keep account for that and then provide a report forward. We appreciate it. Again, we will send a link for those that want to hit the specifics, but I don't want to get too much into those because I'll defer to those publicly reported reports that are already available via our website. I'll do a brief update for Spokane County. At the direction of the commissioners, Spokane County gave a public review session during the 2023 period. It gave a 30-day review for public feedback and comment, and then it also gave us a time internally for the Spokane Regional BHASO and the Community Services Department to give a needs assessment regionally, and then we also provided community feedback on the review of those priorities. So at least 2 months of review, feedback, needs assessment. It's very exhaustive. We gave quite a bit of report. The reality is this: we've identified key areas and had substantial feedback from the community, and we've targeted a couple areas, one of which is the need to immediately implement a approach to treating substance use and opiate and fentanyl use within the community that allows for walk-ins as well as diversion from law enforcement. So one of the areas that the commissioners are highlighting is the expansion of the SRSC, which, for those that know, the Spokane Regional Stabilization Center allows for law enforcement diversions. We want to expand that facility, allow for 23-hour crisis triage and sobering to allow for expanded engagement, specific as we look at medical necessity as the current model has, and allow for walk-ins, community engagement, and even having a medical model so that there's some engagement, let's say, with CHAZ or other medical communities that allow for engagement directly into psychopharmacology, medical support, and comorbidities allow for those issues that may intersect and cause challenges for individuals for their longevity of support in the community. And also those that may be challenged with the traditional engagement of medical. So that is one thing we're looking to expand. We're working very diligently to look at that, and that serves the entirety of Spokane County. So it's a wonderful engagement model that we're looking to explore. We're also looking at expansion of housing support for pregnant and parenting women, looking to do long-term support with children and infants with neonatal absence syndrome. Really looking at saying, if you're setting them up for success, allowing that success to be long-term. So we're looking at that as an option. And we're also looking at potential immediate funding interventions that allow for existing facilities already up and running to begin providing that service. I will halt on providing any more of that information until we're able to provide more information to the board on our projected engagement. Again, those are all things that we know the board has expressed, and I should say the Board of County Commissioners of Spokane County, for the intervention models for the Spokane County allocation of funds. There are a whole host of other things that the board is still considering, but we're looking at two types of intervention. Immediate, what can we fund right now that is a gap in the system, and what are we looking long-term to support the needs of the community into the next 5 years? I think the commissioner is looking at both because the needs of the community need to look at long-term and immediate. So those are a couple items I'll just talk very briefly on. Any questions or feedback on those in the room or on the call before I turn it over to the next agenda topic? Like I said, we'll be sending out the link to our website. It's been available for a year already, but we'll send it out again if anyone wants to look at it. It's very exhaustive in terms of what has been done, but it isn't specific on programs yet. Those municipalities are still working on it. So I'll just throw that out there. All right. So we're going to talk about some initiatives in the region. This is more of the new and emerging initiatives. We've talked at length of other initiatives that have been done for 2023. I really want to highlight things that we're looking to go in 2024. So I'll turn it over to Ashley, our Integrated Behavioral Health Manager, to share on just some highlighted initiatives. Ashley?
Yeah, thank you, Justin. So as Justin said, there's been a lot of work done to kind of lay the foundation for some of these initiatives in 2023 that we're looking to see how they flourish in 2024. One of those being our Mobile Response and Stabilization Services. That was a grant awarded to Healthcare Authority that we partner with them on, and is ran by our provider, Frontier Behavioral Health, to provide stabilization services for youth and families for up to 8 weeks in home. And so that is run in conjunction with their already established Child, Youth, and Family Mobile Crisis Team, being able to provide a longer system of support for those youth and family in the community in home in efforts to prevent from hospital utilization, criminal justice system, and hospital boarding as well. And so they just were able to finally hire, with the workforce shortage going on, all 6 members of that team, and have begun providing services in December of 2023. So we're really excited to see where that goes moving forward. Sticking on the same youth-based track, we have the state-funded Youth Behavioral Health Navigator Program. Regionally, we have identified that now as the REACH program, the Resource Engagement for Adolescents and Children. And that is a program designed to strengthen collaborative communication, service coordination, and data collection, while also deploying multidisciplinary clinical response teams designed to improve access and coordination of services with youth with behavioral health crisis. The priority population for this team is youth boarding in EDs due to lack of placement. And so there's a few different aspects of the REACH program. One is a steering committee that helps guide the mission, vision, and values and goals of the program, as well as helps identify regional action items. The first one that's been discussed in that steering committee is improving access to care for youth. And then another component of that program is that multidisciplinary or multi-system team meetings to be able to staff those complex cases and connect those youth and families to access and coordination of services. Those are the two youth-based programs that we're really looking to see how they can add benefit to our region moving forward. Another program I'll touch on is our Recovery Navigator program. And so that's a program that's in all 6 counties in our region, provided by 4 providers of outreach and engagement services for individuals who come into contact with law enforcement and first responders, with the ability to offer support and referral to treatment efforts to help avoid further interaction with the criminal justice system. And that has been going very well in all 6 counties in our region. And recently we were able to increase funding to allow for better ability to engage and enhance services and expand services.
And of note, I just want to be clear on this. RNP was a wonderful program created by our legislature to look at saying there's a gap between those accessing services and then receiving those services. So there may be some that do not meet medical necessity. How do we help those individuals connect? As well as a diversionary effort from law enforcement engagement so they receive connection. We've been running this program since 2022 and building this out, a lot of partners on board in our region. We, in partnership with Healthcare Authority, who received the funding through us, have put out almost $2 million annually to ensure this program's implementation and to divert individuals from substance use involvement. So when we talk about the opioid crisis and fentanyl crisis, Spokane County, in conjunction with our regional partners, have been implementing engagement since 2022 to really address this and provide no barrier access to individuals who are looking to be diverted away from law enforcement and from the hospitals and other maladaptive functioning ways in those communities, whatever that may be. So based on that, I think it's hard to see as we look at the crisis as it exists in the community, like what are we doing to address those? There's been substantial work and there's ongoing work by wonderful individuals, not only those that are doing outpatient and inpatient services, but those that do diversionary work. Is there still need to work to educate and divert? Yes. Is there funds that are needed for that? Yes. But I think Healthcare Authority, our wonderful partner, as well as our community providers in our counties in our region, we have been working diligently, and then people are on the ground doing amazing work with our first responders. Never want to lose sight of all of that work that has been in place for years, and they're diligently preventing the worst outcomes. So we look at the numbers, they could be worse if it wasn't for all those individuals working. So just a shout out for that and a highlight that we invested even more money this year because of the support of Healthcare Authority. So just want to say thank you, but also thank you to our counties and providers supporting us. Wonderful work.
Back to you, Justin.
All right, back to me. Any comments or feedback on any of that before we move to my last topic? All right, so a gross substitute Senate House Bill 6251 is a really impactful one. It's one that Spokane County and the Spokane region has supported quite emphatically. Very much appreciate FBH and their support in working with us to the legislature as well as our commissioners to support this at the statewide level. Just in brief, this has to speak to the 988 and 988 implementation. So 988 and the regional crisis line through the Healthcare Authority are two different things. So up until recently, the regional crisis line has been operated in conjunction with a provider under the direction of the Healthcare Authority. So anytime someone had a crisis and needed to call a crisis line and receive crisis responders for behavioral health, we have that running. We had that running for years. And that's been under the direction of the Healthcare Authority and in partnership with our managed care organizations. When they came on board, we added them to it, and they've been wonderful partners. So all of that's been running. And then the state passed the 988 bill that allowed for certain taxes to be accrued. So they ran the 988. The access for 988 is absolutely wonderful. the 3-digit line to access to reduce barriers, absolutely wonderful, especially the national move to get to that point. I think Washington was a leader. However, how do we integrate those has always been the question for years, and we've been working with 988, which thankfully for our region is the same provider, FBH. They've been the 988 hub and our RCL hub. No other region has that same involvement or partnership that ours has had. So we have a unique relationship and benefit. Our region doesn't see much of that impact that other regions do for transition because that same provider connects with our external providers, the crisis providers in our 6-county region, as well as for Spokane County. However, I will say this, that during that time, Justin has had wonderful ideas about how to streamline that, and talking with FBH, we've agreed on that. And we may have jumped the gun in saying our plan to streamline that as 988 came on board, we've talked about this extensively, may have been before its time. And so in the last year, we put before it a plan to integrate that and re-look at how money is implemented to shift it to better involvement for rapid response to the community. So in brief, and I know everyone bear with me here, I say that and then we'll go into it. 988 has a separate 24/7 response team as well as RCL. That means at any given time, anyone who calls on any of those lines, there's a 24/7 member responding to that and then dispatching it. That seems duplicative when you only supposed to have one. So we've been running that, we've been running it diligently, thank you FBH. But our thought is if we could maximize what is already being done, most calls, at least 98%, I think it's closer to probably 92% now, and as we look to 988 coming on board last year, have been going to RCL, and then the remainder going to 988. If we were to consolidate that and then use the remaining dollars to put out towards mobile crisis response, it's a better use of dollars. And that's what we told the state as well as Department of Health and anyone who would listen. We did that a year ago. We did it a year and a half ago. Kelly was joining me on that. We said that repeatedly and often. Back when Jeff was also here, God bless him, when he was very adamantly alongside me, we said there's a better use of these dollars. Now, fast forward, we were before our time and the state needed time to accommodate. And so the ASOs as well as Healthcare Authority in support, not necessarily directly, but definitely in spirit, indicated that there needed to be more partnership in how we collaborate those. And we wanted to do this in partnership with Department of Health. That's where 6251 came forward and saying Department of Health has a sole discretion under the previous 98 law to determine who is the hub. And they have the sole discretion to determine that. And let's be clear, that doesn't even occur until 2026 when an official hub is made clear, even though FBH is our current one. So we said, hey, we need to be a part of that over the last year. And they said, well, we need to discuss this. 6251 says no. Regionally, the communities that are affected by 988 need to be a part of the conversation. And I think that's the important aspect of 6051 that I want to put forward. Not only should they be a part of the conversation, they need to be a part of the direction of how those services are dispatched and provided. And that's what 6251 is being pushed and hopefully will be signed here shortly to emphasize is we don't want to control it. We want to be a part of the conversation so that when elected officials in Stevens County, in Pend Oreille, and Adams, and Ferry, and Lincoln, and Spokane County want to say, we think services that you're funding are provided to our residents and our members in our region, we want to have a voice. This allows that voice. Not sole discretion, but a voice at the table to say we can partner. And that's why we supported this and why we firmly believe the work already on the ground of the individuals doing it, the ASO, FBH for Spokane County, and New Alliance for Ferry, Lincoln, Stevens, Pend Oreille County Counseling for Pend Oreille, and Adams County Counseling Services for Adams County should have a say, and their elected officials. So I'm very excited to say this is looking like it's going to pass without any sort of the governor not signing it. And we do anticipate more collaboration with all the parties at the table on how this looks. It will not change day-to-day operations. What it will do is allow the plan that Justin and Kelly put forward a year and a half ago goes forward to allow what we already have in place to be the sole implementation of services and redirect funding to where it's needed most. Direct engagement with individuals in the community needing that service on the ground. So I said it was going to be brief. I apologize, it will be long beyond brief, but I do think it does highlight all of the hard work in this last 2 years that we have been adamant that no other region has been in the same position that we have and does not have the same strong partnerships that we have with our providers. We truly are, and this has been said multiple times throughout this year, have a different thing that we're doing over here. Just leave them alone and let them do it.
Well, and Justin, since you said Jeff's name, I'm going to channel Jeff and speak up uninvited. He'd be so proud. But yeah, just to echo what you're saying, I mean, Spokane's been so unique across the state. They're trying to piece work this together. And we this whole time have said, hold on a second, we got this in our counties. We know our counties, we know our population, we know our providers, we know our clients. And so that makes sense that some work needs to be done, but look at some great things we're doing here. And let's not dismantle that to try to refigure that out. And so it was, Justin, you say we jumped the gun. I think we were strategic and entrepreneurial, but whatever you'll say.
Yes.
But it was very intentional that we went in it together saying our region should have a voice in this structure because we know our people, we know our regions and our providers. And so we too were very pleased to see that language in the bill to allow us to continue. We all know healthcare is local. Let's keep some of that control and input locally.
Kelly, I really appreciate that. And I major shout out to the Board of County Commissioners of Spokane County who supported this as well, who recognized the need for the support as we look at how it affects all of the counties in our region. Because this was not just a Spokane County issue. This is an issue for all of our regional partners who want and have expressed the voice at the table and the need to have that consistently and always as we look at how millions of dollars are spent and the tax basis that comes from those members to the state. So I just want to say to all of our members, Board of County Commissioners Spokane County heard you and they spoke out in great support.
Yeah.
This is where 6251 really highlights that response. And I'm so excited to be a part of that. And I'm excited that finally my plan gets to go forward so long as it passes. And of course, they give me the green light. And to HCA and to our Department of Health, I know there has been back and forth on all of that. HCA has been a wonderful partner. They've been advocating for us on the same side. And so is Department of Health, but they've been concerned about ensuring continuity and sustainability. That's been their concern. We have been very clear that that's what we want as well. And so this has been a great partnership. I think at this level, we're just excited that we get to actually push the go button and do something. At least I am. I know Kelly feels the same way, but for the region, it's been one we've been in stall mode. So very thankful.
It has, and I'll just end with one more thing. I don't know if the county commissioners know this, but part of our discussion is always about supporting our providers too. We don't want to dismantle something and make it more challenging for our providers, the boots on the ground doing the work, more hoops to jump through to get our mobile crisis response teams. Just very important that anything we did made sure that we were taking our providers into consideration as well.
Excellent. Thank you, Kelly. So enough of Justin talking. That ends our update. Any comments, feedback, or questions from those on the call or in the room? This was supposed to be one of the busiest and more cantankerous legislative sessions, but it turned out to be one of the, I think, the most collaborative and less cantankerous. So I'm very excited about this year for Washington State moving forward. Appreciate everyone who's participated in that, just having a voice at the table. All right, we're moving forward to the open public comments from community stakeholders and from providers. I will defer now to our commissioner to lead this section.
Is there any public comment or anything from our stakeholders that they would like to discuss? If you are on Zoom, just raise your hand. I'm not seeing anyone raise their hand. Anyone in our conference room? Not seeing anyone here. I won't go through the first, second, third, but you know the role. So last chance. I guess I will just say, thank you to Justin and your team, Ashley, and Nancy, for all you guys are doing. Really appreciate it. I think this is, important. I know there was a point where we talked about not having these meetings, and I think they are really important meetings to continue to have, so we can just be updated as to what's really happening for all of us. So with that, then we will look to the quarterly meetings to stay on this kind of same schedule, other than just changing it from that 2:30 timeframe to 10:30 on Friday mornings, quarterly. So, excited about that, because I do think it's really important just that we stay coordinated as we continue to move forward, so.
Yes. And not having to hear Justin talk at 4 o'clock on Friday, right before a weekend when you want to go out and have spaghetti or something, so.
Exactly. Do we know the date of our next meeting?
Sorry.
Oh, no, I apologize.
No.
We should just make sure we have that
Yeah, we'll add it.
in the future.
It's going to be June 14th.
June 14th at 10:30 on that Friday morning, which I believe June 14th is Flag Day. So
There you go.
there you go. The town of Fairfield in South County always has their Flag Day parade on that weekend, so that's why
Excellent.
the date sticks in my head.
So if you're not participating in Flag Day, certainly come to this meeting and wave a flag.
Exactly.
All right.
So yeah, with that, if there's no other comments, then we will be done a few minutes early, and we'll let you move on to your weekend. So thank you all for participating, we truly appreciate it, and then we will see you in June.
Thanks, everyone.
Thank you.
Yeah, thank you. Have a wonderful weekend.